everybody. This is Dr. Cohen of Paramedics Spine and Bone Center. Back to another episode of things that you could do throughout your day to help you have a more healthy lifestyle. Today we're going to talk about a subluxation. Many people don't even know what that is. A subluxation is what we as chiropractors actually help people in order to get healthy and, of course, take care of your pain. But I want to show you today exactly what a subluxation is with a model. Here what we have is a functional unit. 2 vertebrae, a disc, the nerves that come out of the IVF, which is the intervertebral foramen, and the spinal cord. When I show my patients on how we're going to help them, I bring this out because whether or not you have pain, that is not what my concern is. Now, of course, through our care, we're going to get you out of pain, but more importantly, I want to correct the subluxations that are in your spine. Here's what a subluxation is. When you look from behind, you see that everything is lined up. That's the perfect, healthy spine. Most patients come in, though, like this. And as you can tell here, we have rotation. This vertebra here is out of alignment with the one below it. What is that? Why is that a big deal? If this just happens, it's not that much of a big deal. You may have some muscle strain and things of that nature, but as this continues, as it goes further, it's going to cause more and more damage. I love to use analogies here in the office, so I'm going to use one with you right now. When you have sensitivity in your teeth, when you have a hot or cold sensation in your teeth are telling you something's wrong. You know, it could be just as simple as it's just an easy cavity at that point. But, you know, we have no time in our day, and, you know, who wants to go possibly to a dentist? I think they're great, and we should all go. But if you don't take care of it, now that cavity gets worse. That cavity can actually turn into a root canal, which is not only more painful, but it's also more expensive to correct. Let's say you don't even care about that and you let it go even further than that, and then you may possibly have to get an extraction. Once again, even more painful and even more money. Taking care of a problem before it becomes a big problem is key. So with the subluxation, as shown here, all we do as chiropractors is move it back into place. That is that noise that you hear, and people call it cracking. All that is an air bubble that is being released from a joint. There is no cracking whatsoever going on in a licensed chiropractic physician's office. So, people ask, well, what takes so long? Why do I have to go for so long? Because when we actually adjust the spine back into position, you have ligaments, tendons, and muscles that are keeping it where it's at. That's where the body is comfortable. So it takes time. We become the personal trainer of your spine. We are training the body to go back into position. Now, you may ask, well, you know, won't this correct itself? Or if I get a massage, won't that help? Or whatever the case may be. The only profession that can correct this is a chiropractor. It is what chiropractors are trained to do. Again, if you decide to just let this continue, what happens is now the spine is out of alignment. So if you think of downward pressure, gravity, it's going to press down. But as it presses down, it's going to press down unequally. More so to this left side than the right side. And eventually what it's going to do is it's going to press on the nerve. I have a better depiction here for you that we have here in the office. This is what a normal functional unit looks like. 2 vertebrae, beautiful disc, a lot of space for the nerve to come out. Over time, when there's rotation, when there's a subluxation, this starts to change. So the downward pressure now starts to affect the disc. The disc becomes degenerative. When the disc gets degenerative, now it starts to lose space. As it loses space, you start to bulge the disc. The bulging of the disc now starts to put pressure on the area in which the nerve was coming out of. And so on and so forth. Then you have a herniation. As you can see here, that nerve has no space anymore. It doesn't have space to breathe. That's when somebody has such pain that they have numbness or tingling. When they can't move, they fall to the floor and such things like that. Does not necessarily mean you have a herniation. it definitely means you have a subluxation. Okay? So as this goes down, as you see here, then you get arthritis and deterioration. All of this can be avoided if you just get your spine checked, if you exhibit proper posture, and like I've said in previous videos, concentrate on proper ADLs, active daily living. Again, please follow us, because in our future videos, I will explain other things that you can do to help yourself to be healthy. But in this video, I'm explaining what a chiropractor does, what most people get, which are subluxations, and you don't even know about it because we're so concerned and focused on pain. Listen to your body. Do what your body knows it needs to do. Thank you for listening. Have a great day.